I've never heard of Bill Share before, so let's start there. So I fall into that category of United, Aetna, Blue Cross, just like a lot of Americans, being self-employed or working for yourself. I was paying $2,700 a month. This was 4 years ago for major medical. I had a $6,000 deductible per family member. And when healthcare sharing was introduced to me, it was almost too good to be true. It was like, okay, how can I go from the 2,700 down to the 600? And how can my deductible be cut in half? So immediately they had my attention.
Welcome to the Deconstructing Conventional podcast. This interview is brought to you by Healing United, a private membership association committed to helping you reclaim sovereignty over your health, life, and future. You could say our tagline is question everything and rebuild intentionally. In the audio format of the show, there's additional commentary before each episode, and there are also over a dozen audio-only episodes. You can find the show anywhere you listen to podcasts, including the Healing United PMA app. Look for it in the App Store. And if you want to learn more about the work we do, and especially how we help people heal when the doctors have no answers, visit us online at healingunited.today. Now, on with the show. All right. Hello, everyone. Welcome to today's show. My guest is Mr. Patrick Mazer. He is a man of many talents, and he's been a full-time entrepreneur for 25 years. He's run many different businesses over his career. And one cause he is passionate about is disrupting the status quo in healthcare and bringing awareness to something most people don't know. So I wanted to bring him on today because he knows he's probably done more to increase the awareness of healthcare bill sharing than anybody I'm aware of. So Patrick, welcome to the show today. Thanks for hanging out with me.
Man, great to be on here. Excited to share some information with your audience.
Awesome. Okay, so you haven't heard my opening monologue yet, so you're not fully aware of the breath of fresh air you're about to bring to this episode. But I'm excited for you to just contrast the difference between insurance and bill sharing. So let's just kind of dive right in. So for people who are unfamiliar with healthcare bill sharing, just explain the model. Where did it come from? And how is it different from insurance?
So first of which, I've never heard of Bill Share before. So let's start there. So I fall into that category of United, Aetna, Blue Cross, just like a lot of Americans, being self-employed or working for yourself. I was paying $2,700 a month. This was 4 years ago for major medical. I had a $6,000 deductible per family member. And when healthcare sharing was introduced to me, it was almost too good to be true. It was like, okay, how can I go from the 2,700 down to the 600? And how can my deductible be cut in half? So immediately they had my attention, and come to find out for, 40 plus years, healthcare sharing had been something that had been done primarily in churches, even further back into the Amish where pass the hat, Mary got sick, let's all put a couple dollars into a fund just to pay their medical expenses. And it worked extremely well. Over the years, it got a little more formalized, and now it looks and feels and operates like a traditional health insurance model.
Gotcha. Okay. So you mentioned churches. So where there's a lot of different options people have out there. So the one we're going to talk about more specifically is Impact Health, but they're a nonprofit like a lot of the other ones. So kind of talk about why the nonprofit angle is important.
So a couple things. One, governmentally, you have to be a nonprofit. So, what a unique idea. Take the profiteering out of healthcare. What a conflict of interest. Should we help the patient or should we help the stockholder? So there's a really unique opportunity here for us to be able to save money when it comes to taking care of the patient, because we are a nonprofit. And so first of which, that's how they have to start. Impact is a come one, come all. So what that basically means is we're not religious focused, meaning you don't have to be a certain religion to become a member of Impact. And because of their nonprofit status, it really allows them to help the patient about 50, 60% less than a traditional insurance option.
Yeah. And so that obviously got your attention. So and it typically is the thing people are arrested by first. Like, wait a minute, you're going to save me how much money? And I guess there's often a perception like this coverage probably isn't as good then if I'm paying that much less and my deductible's less. And I mean, for me, my family there's 8 of us. So what I love about impact is it's three or more is the bill doesn't go up. So for eight of us, $571 a month was a no brainer. So I guess talk about the pricing specifically. How much you're maybe saving more than the average person, but I know insurance often gets priced by how much money you make or how much your employer makes. And so talk about kind of the average savings any person gets going this route, and then we'll get into what's covered.
So, great question. Look, comfortably, they advertise 50%. And to your point, the subsidies have went away. So
Mhm.
2026, we had the government shut down over the cost of healthcare, and everybody was going to get a massive increase. And, the government said, let us, stand outside for 30 days. And unfortunately, after 30 days, they came back and said, there's nothing we can do. You're all going to pay 30% more. So I think everybody felt it this year more than they ever had. In having said all of that, when you look at the savings side of it, to your point, you have 8 people on your policy, you're able to get all 8 covered for under $600, which in my case, I have 4 on my policy and fall sort of in that same range. So whether you have 4, 5, 6, 7, or 8, the cost is the same. 3 plus the cost is the same.
Okay. Well, then, so let's talk about coverage because that is something people often, I guess, they're leery that is it going to cover everything the way I want it covered. So, kind of talk about the breadth of what gets covered. And if you want to pull up the website and kind of use that to talk about it, that's cool too. So,
Absolutely.
for
So
for you guys listening, we'll just kind of do our best to describe it if you
if
can't
I
see what
just
he's
put it,
referencing.
side by side, this is major medical. And when you think major medical, here's what I want you to think. Anything from a scratch to a organ transplant, right? Anything that someone's going to need when it comes to the medical side of coverage. So if you look at the way impact works, it's a 30 to 50% savings. Second of which is our what we would call a deductible. It's called a PRA. It's so personal responsibility is $2,500 as our whole family. So that means all of our medical bills together. That's a huge distinction compared to a traditional insurance, right? Because they do it per member in the family. We do it as a unit. The part that people are pretty excited about, and Christian, I think you'll see that as well, it's no network. You get to go to any doctor you want to go to. And that's a huge, huge benefit. When you have a problem, you want to go to Cleveland Clinic or Mayo Clinic, or you want to go to the best doctor in the country for what that member has, they're free to go anywhere they want. And so we're also giving them things like telemedicine included. We're giving them things like a wellness credit. All that basically means is if they go to the gym or eat a vitamin or get a massage or go see a holistic doctor, we let them take that off their deductible. So we're partnering with the members to say, hey, the healthier you are, the better it is for the group. So if you go to the gym, or you play pickleball, or you like to golf, or you do things that are active, let us reward you by allowing your family to take up to $150 a month off your deductible, or what you would know it as a deductible with impact.
That's awesome. I can't imagine people are used to that with insurance. So, okay, a couple other things that are covered or not covered. So, give me some insight into maternity care, vision and dental. How do people leverage impact for those services?
Yeah, so what's great about Impact is they have a very easy to read guidelines. So if you want to have a baby at home, they will fully cover that, a birthing center, a doula, or just a traditional way of having a child. Second of which is we do have a dental and vision program. It's a discount program. All that basically means is we've already negotiated what those costs would be before you go see your dentist. So there's no sticker shock with a root canal or, hey, you had to get some cleaning and x-rays. All of that is already pre-negotiated for both dental and for vision.
Okay. And then when it comes to pre-existing conditions, give people an understanding if they're hearing this and like, wait, I could save how much money, but I also have this problem. Help define the pre-existing condition puzzle for people.
Yeah, so let's talk about another factor of why Impact can do what they do at such a cost. Because they're not insurance, we're not forced to take sick people. And all that basically means is we're starting with a healthy group of people. Now, if you get sick while a member, all bills are going to be paid. If something unfortunately happens and you're a member, those bills are going to be taken care of. So we do what's called a 36-month look back. We just say, hey, over the last 36 months, have you had a problem or do you currently have a problem? Because as a community, we don't want to share in somebody's medical bills that's coming to the community sick, if that makes sense. Now, high blood pressure, high cholesterol, that's not really a concern if it's medicated and taken care of. Those things are unfortunately being American, right? So we're looking for people that, hey, I'm pregnant today. I want to join your share so you can pay $100,000 for my birth. That's not going to be a customer for us. But if you already had your baby, you can sign up immediately. You and your baby would be fully covered from that day moving forward. So look, I've ran into people that unfortunately have had, challenges where mom's had some sort of very unique immune disease challenge that, would be looked at as a pre-existing, but we decoupled the family, Christian. What did we do? We said, hey, your children and your husband are completely a fit for impact. Save $8,000 a year, bring them over here, let mom stay with who she's with now so that she can continue to get her care with her current situation. And down the road, if 36 months pass and she's healthy and no symptoms, we can then join the family. But in the meantime, let's put an extra $8,000-$10,000 a year back into your family's budget.
Nice. Okay. So talk about people over 65. So Medicaid, Medicare, that puzzle of am I covered? What's covered?
So we cover anybody over 65 that has Medicare Part A and Part B. Um, it's called a supplemental. Now, there's no pre-existing challenges there. All that basically means is even if you're currently under doctor care or sick, we're going to pay all medical bills that Medicare does not pay. Now, there is a $1,000, what you would know as a deductible, so 0 to 1,000. The member's responsible for. After that, Impact will pay all the bills. My mom was a retired school teacher. Her supplemental was $170 a month.
Nice.
Impact was 96. So, she saved, let's call it $1,000 a year. But here was the part that really resonated with her. When you go to a supplemental, they have a network. And unfortunately, they're putting you in their McDonald's doctor. In a lot of cases, these guys are overworked, underappreciated. They don't really have a lot of bedside manner because they're being, they're overwhelmed with customers coming or patients coming in the door. Once she went to Impact, we were able to find a cardiologist that had a little bit extra time, was a little better with my mom as far as questions and answers and, medication things. And so she was free to go anywhere because Medicare's basically anywhere. It was the supplemental that was driving what doctor she had to go see. So saved almost $1,000, let's call it, 800 plus dollars, was able to go to the doctor of choice, which was a huge benefit, for my mom as a retired school teacher.
Yeah. So really, it doesn't matter what age you are, there's still options. And as the older you get, over 65, the rates get better and the benefits get better, is what it sounds like.
Yep. And so it's looked at below 65 on your age, right? Which think about it just like common sense wise. If I'm 22 years old, I should only pay $70 a month. Why? Because I'm a brand new car, right? I don't expect anything to happen, right?
Yeah.
I got 47,000 miles on it. Yeah, you're probably gonna need some tires and windshield wipers and other type things. So they're gonna rate us according to our age. As we get older, we have a small little increase over time, as an individual or a family. And it's based on the oldest member of the family. So how they figure this out is you can quote yourself. You can literally put your date of birth, who's the oldest person in the family. In my case, it's me. My wife's younger than me. I've got 2 kids. Great. Then I can pick what I want my deductible to be. If I want a big deductible and I want to pay a little monthly share, that option's available. If I want a small deductible and a bigger monthly share, that option's available as well.
Nice. Okay, so talk about some of the services not offered, because it's a nonprofit. It has values based. There's some services that they don't want to provide. So tell the listener some of those services.
Yeah, so we're as a community are not going to pay for transgender. So if somebody is looking to go in that direction, that's probably not going to be a fit for our community. That's going to be something that they would have to pay on their own. Abortion would also be something that they would not, as a community, believe that we want to have to pay for something like that for a member. So pretty simple things, not a lot, but there's going to be some things that as a community, they just don't agree with.
Okay. Yeah. So those are just awareness for that. I guess if you really wanted it, you could pay for it yourself. But I like that personally as a value because I wouldn't want my money going to that either. So, okay. So let's talk about, because Impact Health is not the only dance at the ball when it comes to the medical sharing model. So give the listener a couple things that differentiates that you already mentioned that there's no religious requirement that a lot of them have. What are some of the other things that make Impact stand out in your mind from other options out there?
So, couple things. First of which, I had never heard of healthcare sharing. I am talking to people every day. Probably 9.5% of America doesn't even know this exists.
9.5 or
So
99 point?
yeah, right. Well, let's say just under it.
Okay.
There's a couple million people on it, and let's just look at it as a whole. They have a 98% retention rate. Now, I don't know anything else in America that has a 98% retention rate, right? People come, people go, and whatever that may be, maybe don't buy the same car every time you shop. So there has to be a reason why people stick and stay, right? Why does somebody get in and never get out? Well, I believe there's a couple things. One, it's a little re-education to get in, right? So to your point, there's going to be many options in this space. Most of those options are a reimbursement model. And what does that mean? That means you go to your doctor, you pull your American Express card out, you ask for the cash pay option, you pay the cash pay, and then you send that medical bill into the share, and the share sends you a check. That's how this is operated for, let's call it 30 years. And it's done well. Like there are people that were 100% fine with that. Millions of people said, hey, just in case, God forbid, if something were to happen, I got to pay for it first, but then I'll get reimbursed. So that's called a reimbursement. Where Impact works and looks like a traditional medical insurance company. They give them a card, they walk into the doctor, they present their card, the medical bills go to Impact. Impact would then negotiate the bill. All that means is make sure that we're not overpaying for the medical procedure. And then they would pay the medical bill on behalf of the member. So it works and looks and feels like more of a traditional type medical coverage for people like me that have never heard of bill sharing or healthcare sharing before. I'd like to say they're the modern version, if you would. Technology has come a long way. They're not clunky like the old way of doing things. I think they had a great idea, but they just didn't have the technology to support their great idea. Today, we've got a tech platform, which you and I were, looking at just even a couple of minutes ago, complete transparency.
Yeah.
People's bills getting paid real time, doctors getting paid in 13 days. I talk to doctors, on a weekly basis that said nobody pays in 13. We're used to fighting. Remember, there's two sides to healthcare.
Yeah.
One is the patient, that's us, right? We just hope to God we never need it and hand the card and okay, let's get better. But the second side of healthcare is the physician or the medical practice getting reimbursed by the health insurance company. And so Impact is 13 days on average. They advertise less than 30 days to get the medical bill paid. But right now, today, they're running 13 days.
As the average. Yeah, which is probably a breath of fresh air to so many doctors. But I want to piggyback on something else you said just about the reimbursement model versus the bill pay model. So for about a dozen years, I've been using bill sharing and it's awesome. But yeah, to your point, I would have to pay the amount and then I'd have to wait for checks to come in the mail from other people in that network. And sometimes they come late, sometimes they don't come. And this just was like, oh, simplify. Like I just pay them and I don't have to, because we also had to send a check every month to somebody. And then did they cash it yet? Or like, I don't know. And to have that part removed is just so nice to go, oh, I just pay it like a normal recurring bill. Don't have to think about it. And the Impact takes care of the rest of it. That was a big benefit to us. Just a little less logistics to handle. Another thing, so you mentioned no religious requirement, transparency. Let's pull up the member dashboard because to me, this may have been there's the savings and the ease of the technology was important, but the transparency Impact has was like you will never get this with a health insurance company. You can pull up the dashboard in real time and they will show you how much money they have in the bank, where it's going. And to me, it stands in such sharp contrast to the model that we're all used to of this obscure, where is the money going? Why does the C-suite have so much money? And why does somebody want to shoot the CEO of United Healthcare in the back of the head? Like, what is going on behind the scenes? Here you can just pull up the dashboard and go, here's how much money Impact has.
Yeah, so a couple of things. One, just to, show someone, hey, look, if you want to quote yourself, right, you can do that on your own. Don't need to call someone or, put your own information in here that's going to immediately give you what you would pay. It's going to tell you some of the benefits, a concierge service. What does that mean? Meaning direct pay to any provider in America. So they have a concierge that says, hey, we'll call that, hospital and make sure that they're happy with you coming and getting all their medical bills taken care of. The rewards we talked a little bit about, the annual wellness visit with labs included. We also have virtual healthcare. I mean, I've used this more than I wish I would, but I've got kids. I'm sure you can relate where it's like, no, let's not go to the ER. Let's talk to a doctor first. Let's make sure that this is big enough that we need to leave our house before sitting with a bunch of sick people. And then we also have virtual therapy, which unfortunately has really exploded after the pandemic. People just need to talk to somebody. That's already included. They can use that as many times as they want. And now to bring up the dashboard, this is something for those of you that are listening and not looking. This is the most fascinating thing I have ever seen. I think what is the theme of the last 36 months in our country? Transparency. Right. I think that, you turn on the television, they're talking about it governmentally. Where's the money at? Who's doing what with the money? This shows every dollar collected. This shows every member and what part of the country they're in. Right. So 4,400 members happen to be in Texas. Here's the Taylor household. They just got a $251,000 medical bill taken care of, $68,000 medical bill taken care of. No, it's just their household. You can be anonymous if you want. The reason why they post the name is they want prayed for. So if you want to pray for them, they encourage us to do so. But bills process 13 days. Here's the beautiful part about it. So imagine who shows the books, right? I think we all would agree today that nobody shows the books. I mean, this is, hey, how do I know my bills are going to get paid? Because we have $40 million ready to deploy and pay people's medical bills. And then the simplicity of navigating, my submitted bills. Here's my family. I was talking about this earlier, but you could see I went to the doctor November 5th. They received the bill November 10th. It was completed November 22nd. I owed $138 off of a $317 bill. Simple.
Yeah.
Not complicated. No questions of like, hey, what's the deal with my bill? All of that is so refreshing. And I could talk about this all day. Prescriptions. I had, unfortunately, a woman that she said, well, I need, metformin. Okay, great. Here, pulls up the address of the customer, gives you the ability to be able to pull up what your pharmaceutical costs are. I can go to Walmart and pay nothing for it. People are paying $40, $50 a month for a drug that we pay no money for. And the reason we don't is because Impact is not making money on the pharmaceuticals. I had no idea when I walked in with my Blue Cross card that the pharmacist could never tell me what the cost of the drug was because there was a markup from the insurance company to the pharmacy. And so when I found out that these drugs are cheap, as you probably already know, and that they're free for 99% of the drugs, people can't believe. It's like, man, this is really exciting for people that are looking to save money. I mean, this is a saving money platform. It just needs awareness.
Yeah. Well, that's part of why I'm doing this show is I love taking people out of broken systems or wasteful spending. And I do my best to get people off medications for the record and not need them. But when you're weaning off that, you got to start saving money right out of the gate is awesome. So, okay. Then another fun thing that we talked about was the rate stability because everyone's used to their insurance rates going up. So talk about Impact Health's rate stability.
Yeah, so they've never raised their rates over the last 6 years. So let's start there. Everybody else, there's not one that hasn't, period, across the board for the last 6 years. It's been, whatever those percentages are. Some have been a lot, some have been, double digits. And so Impact's never raised their rate. What they've done as the community has grown and as the pot, if you will, of insurance, let's call it, has grown, Impact has found ways to give money back to the members. How is that? Well, they started with a rewards program that said, hey, we'll give you $100 a month off your quote unquote deductible if you go to a naturopathic doctor, if you go to chiropractic, if you eat vitamins, if you have a gym membership. And as our membership has grown, so has the amount of money that we've had. So in Impact said, hey, we're going to go from $100 to $150 every month to give money back to the membership pool. So, not only have they not changed the rates, not only have they added dental, added vision, not only have they gave us free telehealth, not only have they given us therapy, right? So that we can talk to, not only have they given us, some of these additional benefits that didn't exist 6 years ago, they haven't raised the rates and they found ways to give the money back.
Yeah, which is just contrast that with what you guys heard me say in the opening monologue, or the different mindset, the different humanity of we have money that we got to figure out a way to give it back to the people rather than we got to figure out how much money we can extract out of you, which is kind of what the medical system or the insurance more in particular is kind of turned into. And it's such a contrast to say, what other ways? Let's add more coverage. Let's find different services people can go to. Let's increase the deductible deduction everywhere we can. And they know their math well enough to do that, which is the part I love about it.
Yeah. Yeah. And look, I mean, nothing's perfect, right? So let's start there. I don't want to, over promote and, this is not going to be the perfect fit for every person that you and I interact with. But for people that it is a good fit for, we're saving people $10,000 a year. We had business owners that never offered health care, that had great employees, people that were part of their family, right? When you're dealing with 30 employees or 20 employees or 10 employees, the CEO or the president or the owner looks at them more like family members than they do as employees, because when you're in an office of six, you sort of have your work family and you have your natural family. And to be able to say, hey, we've got an option that they've never even heard of. We've had literally business owners for the first time in the entire history of their company go into their employees and say, we can provide medical benefits. We can actually support you and your family in your time in need. God forbid you get sick. You're a family member to us already. And it has been some of the greatest stories that I've ever experienced, because unfortunately, people were leaving that small business model and going to work at UPS or FedEx or Amazon or one of these, companies, not because they're passionate about the vision of Amazon. It's because, mom wants to have babies and, we're not going to be able to do it working at the local mechanic shop that's never going to give me benefits. So this has been extremely rewarding because we're able to give them something that they've never given. And in some cases, they pay 100% of it because it's $150 a month or $70 a month or 200, you know what I mean? Like because they're used to getting the $1,800 quote or the $2,200 quote or the $900 quote. And we're walking in saying it's 200, but $200, I'll pay for the whole office at $200.
Yeah. So it's refreshing that business owners can do this. And they have a group buy option at Impact as well, where you can just bundle all of your employees into one bill. Is that correct?
Yeah. And we don't, and look, because we don't fall under the insurance guidelines, we can sign them up 12 months out of the year. Now, unfortunately, we see job loss happening, right? It's not as good as everybody might look in the media. We know that there is a percentage of Americans with AI and other disruption that are happening that are losing their jobs. And when you lose your job, you lose your health care. When UPS laid off 58,000 people that day, every single one of them were transferred to Cobra. And that is the full price of healthcare. And so you talk about a double negative. Obviously nobody wants to lose their job and then to lose their healthcare on the same day. That's a very tough pill to swallow. We've been able to immediately protect their family because we can offer health benefits 12 months out of the year. So that is a huge conversation because look, somebody in your audience now has someone they love that unfortunately is looking for a new career. And if benefits are the driving factor, sometimes they have to take the first opportunity because they got kids. You got lots, right? So I can only imagine like we're not rolling the dice on health coverage, right? We're one appendix away from bankruptcy, right? We're one gallbladder away from 85% of all bankruptcies in our country are medical bill related. It's the unfortunate situation. It's something that nobody expected to happen. And so for us to be able to give medical benefits to people 12 months out of the year is a huge blessing for people. And then on top of that is to be able to give them the freedom of choice. We talked about going out of the country, right? People go on a trip and unfortunately, have an accident. Well, we know that if you're in Mexico or another country, no one's going to pay that medical bill. That's your medical bill.
Yes.
So Impact will actually reimburse us if we pay an emergency medical bill in Mexico. We can come back, do what you've done for years with other shares, right? Send in the bill and they send you money. Impact will work the same way. So there's so many beautiful options that are here that people have no idea that goes along with the healthcare sharing benefit, including freedom of the medical doctors treating you the way they feel fit. Meaning we're not reading medical notes. Impact's not dictating to the doctor, hey, push him into the pharmaceutical world. They're letting the doctor do what the doctor was trained to do.
Yeah, well, yeah, you mentioned to me earlier you had a conversation with, I think it was Peter McCullough, about medical freedom. Tell the listener his comment about what this model does for the patient.
Yeah, so Dr. Peter McCullough, I only knew him by name, right? I think we all did. This guy came out of total obscurity in my book, double board certified, Baylor, just the straight edge, just like the kind of doctor you wanted to see, right? So as we're sharing this, and it really fell on a lot of very vigilant people like you that said we need to get the word out. Like this needs to be known by people. So he came and got a chance to hear the Impact story and what we were up to. And at the end of it all, he said, well, you got medical freedom. And I said, okay, that's great. I don't understand. He goes, no, you don't understand. When you walk in the door, we have to do what the insurance company says.
Right.
If we know you're not going to allow a PET scan, we won't even write the script. If we know you're not going to be allowed an MRI, if we know that they won't let you stay 3 nights in the hospital, but only 1 night, not because we recommend it, we feel you should stay 3, but your insurance company says 1, you will leave at 1. So Impact is not doing what these other, type of companies are doing, which is dictating to the doctor. We're giving complete autonomy to the doctor to treat the patient according to the way that they feel is best suited for that patient.
Yeah, yeah. For those of you listening, if you haven't heard my interview with Dr. Stuart Fishbeiner and midwife Bliss Young, we talked about the handcuffs doctors are in and how employment and insurance and the buying up of the basically a lot of the healthcare world has created the problem Patrick just laid out. Like doctors really have freedom to just doctor again in a model where we're just trying to figure out how to do right by this person. That's what I love about this model or Impact in particular is they kind of just step back and say, what would be the ideal scenario? What would be the ethical thing to do? How would we actually genuinely care and take care of people? And that, of course, if one of your members goes overseas and has an accident, of course we'd help that person out. Of course, if they needed a device, if they needed a scan, we would cover that. We wouldn't try to figure out how to just keep our doctors with a focus only on profit. And it's so refreshing to go, oh, like humanity has returned to this thing that we call health. It's such a precious thing for all of us to have that be something that you can step into and save a ton of money in the process. Hopefully you guys are catching the vision for what's so different about this model. So one other story I wanted you to put on the record here was the one about your wife needing a device for a situation that came up and what the doctor told you about what you could get and not get. So tell them that story.
Yeah, so you look to your point. First of which, this story needs to be told, meaning people need to know this option exists.
Yes.
I would have been here 10 years ago, even with the reimbursement model, right? Because I never hit my deductible except for two kids. And so for the last 20, year, I just paid, and two seasons, two kids, two deductibles met. And then every other, $3,000 a month, 2,500 a month, for decades. So having said that, my wife broke her foot. And unfortunately, and we did the standard orthopedic and we did the podiatrist. You have no network. So finally I said, look, it's not healing. Like this doesn't make sense. Let's go see the Dallas Cowboys orthopedic doctor. So I Googled him, right? So who is the Dallas Cowboys, and here, came up the orthopedic doctor. And we went to see this man. And great doctor, and obviously dealing with people that their body is really important, that is their money maker.
Mhm.
And he said, you've got a break, it's a clean break. He said, but you're going to need what's called a bone growth stimulator. He said, because it needs to stimulate the bone to start to grow, right? That you have a clean break and this is where you're at. He goes, now unfortunately, it's going to take you about 16 weeks to get it, because insurance will make you follow a protocol, right? So they're going to make you do this and do that and spend time. And eventually they're going to come to the same conclusion I already came to. He said, now the athletes just buy it, right? It's a couple $1,000s. He said, they don't want to wait 16 weeks. They need to get back on the field. And so the doctor wrote the script. And the following week, we had the device. And, and he was so blown away, Christian. He was said, what is it you have? Right? Like, why? How did you get it? Because of the fact that Impact said, if that's what you need, that's what you get. And again, for us as a family, that was really when it went from, from a this is great to we have to tell everyone, and I don't care if I'm sitting at the school line picking up my kids, my kid's teacher, she said, what are you up to or what do you do? And I said, I help people with healthcare. And she was like, you're funny you're saying that. The school system only pays for the teacher.
Hmm. Not
Her
the
husband and kids were paying 1,500 a month. Now, nobody's getting rich teaching school. I think we all would agree, right?
yeah.
So 1,500 a month. I showed her, pull up a little thing, $372. Immediately saved them $13,000 a year in one little teacher conference, just showing them what I showed you. Let them go in as a quote. Hey, you can talk to Impact. You can get your questions answered. And so, for me to be able to give back in that way, to say, look, that's a vacation. I mean, a nice vacation, right?
Yeah.
It's a
Right.
12,000. I mean, you're going somewhere with sand and palm trees and you're having a great, magic moment with your family, all because I opened my mouth and said, hey, this is, an option that you might not know exists. And I was blown away at how many teachers don't have health benefits for their family.
Yeah. Right. And now they are aware of an option that they weren't before. So
Yeah.
we're doing our job. Okay. Well, let me tie up a couple other loose ends. So back to the doctors and any doctor that is that my audience is probably more in line with like a direct primary care. If you're a
Yeah.
doctor and you have your own more or less membership model, you don't take insurance, you can still take impact. So say that for me in a different way. Let them know
Yeah.
that this is a part of
This
one
is
of the ways they hadn't thought outside the box of insurance or no insurance.
so what's wonderful is we work with direct primary care doctors. And the reason I share that with you is if you see a direct primary care doctor, you're allowed, right? Do you have a direct primary care membership? You can take that off your monthly deductible, or what we would know as a deductible is called primary responsibility amount, but you can take that off. So I've helped multiple primary care doctors because they said, look, we're here for the consultation, the sniffles, the, need something now type situation. But if you need your appendix out, we're not going to do it at our office. You've got to go to the ER, you got to go to a major hospital to get that done. So we've been able to put this on top of what they already have, give them the protection for the unfortunate major problem, but at the same time, work in relationship with people that fall into that model. And it's been a breath of fresh air because one, some of these people don't have major medical, right? And my direct primary care doctor said, you still got to get major medical. Like, you know what I mean? I'm not going to let you walk around without it. I'm going to be your 99% of the needs you're going to have. But that 1% need of a broken arm and needs to be my wife's situation, we're not going to do that in the office. You're going to have to go see someone else.
Yeah. And then chiropractic too. I was refreshed to see that that gets covered by impact. So let people know about that option.
Yeah, so we do 50 visits for physical therapy, 50 a year per member. And part of that would fall into the chiropractic space as well. So again, for people that, want to go in that direction. Now it's more for people that have been injured, they're not there for maintenance purposes. I go for maintenance, like I've been under chiropractic care my whole life. But I take my adjustment off my monthly $150 reward because it's for maintenance purposes. Unfortunately, my brother was in an accident, trauma center, got out, physical therapy. He did all 50, but what was great about that was he was able to interview the physical therapist he wanted. Right. Because my brother's a little bit of an, like I need someone tough. So he was like, I went to 3 different ones. And the third one, the lady says, you won't like me. He said, well, you're my girl. Like, like I need someone to push me and make it hurt and get me through this and on my way to getting healthy again. But it was just cool for him to be able to go to 3 different ones to find the one that was like, hey, we mesh. Let's do 47 more sessions. I used my first 3 figuring out who I want to use. And then from 47 on, he used the same woman and by the way, he lives in Puerto Rico. So let's start there. So he lives in Puerto Rico, got in an accident in Puerto Rico, went to the #1 trauma center in Puerto Rico, had all of his bills paid by Impact, had his physical, everything. I mean, imagine if he would have had another option. We all know they would have, what? Puerto Rico, that's not in America. No, well, technically it is, but all of his medical bills were paid.
Man, fantastic. Okay. Well, the other thing I want to highlight for people, I guess before I get there, any other loose ends related to coverage, not coverage? Thank you. The questions people have?
Yeah, look, I think the only question that people have is why is it so inexpensive? We've already addressed that because we're dealing with people like me that never heard of this before. So there's little re-education, right? There's a little, hey, it's not a cab, it's Uber, right? It's not a hotel, it's Airbnb, right? It works the same, feels the same, a little better in certain situations. That's where I think impact lands into that place. Second part of that is, when it comes to will my doctor take it? Impact will have you go get a physical, right? So what I do when I sign somebody up with Impact, I said, great, call your doctor, schedule a physical, right? Your primary care doctor, and Impact will reach out to the doctor and prepay for the physical. Now, when that doctor gets prepaid, your doctor is going to say, I've never seen that in the history of medicine that somebody's prepaying for a physical, but it puts us into their billing system. So we never have to have a challenge moving forward, right? All hospitals are already in the same clearinghouses, things like that. But that's going to be the only, will my doctor take it? Yeah, we're going to have you go to your doctor and we're going to have you go get a physical and go get blood work so that you are able to continue to see that family doctor as much as you want. But it's going to allow us to partner with them, go into their billing system, and we'll never have an issue outside of that. So that's really the only pain point I would think for people to go, hey, your doctor probably never heard of healthcare sharing. They definitely never heard of Impact Health. Like, the odds of them hearing of Impact is probably 0. But when you get your physical and they prepay for it, they'll know who Impact is and they'll be graciously excited about wanting to do business with Impact.
Yeah, well, and I think I've heard a story or two of people who have gone, they've showed the card and the person at the desk says, we don't take this. And they say, yeah, actually you do, you don't know it. And they get them to call Impact and the place, oh yeah, there are in our community, we'll cover that. Yeah.
Yeah. So there's an 800 number on the back. There's an EDI payer ID number, but again, if you go in and, hey, I never heard of that, because remember, they're pretty conditioned at this point, unfortunately, like, we only take Blue Cross, we only take United, so it's a little bit out of the box for the person at the front desk. But as long as they can contact Impact, there's going to be no issues. And again, for me, saving $24,000 a year, I'll deal with a couple little bit of hurdles. Like, you know what I mean? Like,
yeah,
I'm over $100,000 in savings since saying yes to Impact. So, to me, little speed bumps aren't a big deal when you're saving that kind of money.
Yeah, that's a good point because I have that a lot in the natural health world is helping people get comfortable, familiar with a new tool. And Impact's just another one of those. If you want coverage for anything significant, I've got 5 boys. I definitely want to have backup if anything happens. then yeah, I got this in my pocket, and I have a little bit of education to go through to use it well. But yeah, the peace of mind is just awesome to know that's there. I guess the one last thing I want to highlight, because this is another thing that stood out to me about impact. So the previous healthcare bill sharing company I was with, they would pay me $100 for anybody referred, and I love the model and would refer people, and I got a one-time payment of $100. Impact also uses just relational marketing. They don't have big ads they run. You won't see a Super Bowl commercial for it. They offer referrals or commissions to somebody to refer them, but they pay it residually. Every single month somebody pays their bill, I could get a referral bonus. I'm like, wait, what? So tell people a little bit about that. If they're interested in helping promote or share this model, they could make enough to cover their monthly bill, or they could make more if they so choose. So let people know about that aspect of impact.
Yeah, so Impact was very smart in looking for an affiliate type relationship, like because this needs a nurturing conversation, right? I would have walked past Impact if it was a billboard on the side of the road for $400 for health coverage for my family. I would have said that's for poor people. That's not major medical. Me and my wife would have drove right by that, never looked back twice because, that wouldn't be for us as business owners. So what Impact had said is said, hey, listen, if you will help bring us members, right? If you put the word out, if you let people know there's another option, we'll partner with you and we will pay you a percentage of whatever they spend on a monthly basis. So it's called residual income. So the beautiful part about it is by making natural referrals, Impact will talk to the customer, Impact will educate the patient, read the guidelines. But if they came through you, Impact will pay us every month for as long as the customer stayed on the service. So for people that are looking for that additional income or, look, I would be promoting it even if I didn't get paid. Like this is that good, right? I feel that obligated to do it. But my experience is that you can't mention healthcare in today's world and not have 20 people want to hear more. I had a woman that was on Nextdoor. I don't know if you know what that is. It's sort of like a community. And she said, hey, I, went to Impact and I saved $20,000 a year. And literally she had comment after comment after comment after comment after comment of people like, tell me more. And so I believe they've picked the right way of doing it, which is giving us an incentive to talk to people, but an ongoing payment that we can continue to make money on. So let's say you referred, I don't know, 50 people, you would have about a $2,000 a month reoccurring revenue. So no one's breaking any sales records, but if you got 50 friends or 50 people that you believe that would benefit from another option for healthcare, great. Let us pay you for that. Let us keep paying you for that. And you maybe get more motivated and get a couple more, maybe not do that much and just pay your own share so you can get free health benefits.
Yeah, it's as aggressive as you want to be. If you know, a friend who owns a small business and he's paying for his employees, then he could sell, 10 at once, and then Impact just pays you for that. So it was refreshing to go, wait a minute, I'm already doing this. Like you said, I've been telling people about this for years, and the one-time bonus is nice, but like you, I wasn't in it for the money. It's just worth sharing because it's pulling people out of waste. And now to know, wait a minute, just by sharing it, they'll let me know. They'll say thank you every month with a little commission. That was another draw that made me say, I have got to get the word out about this more, because in my realm, censorship's a real thing, and I could be unplugged anytime, and big tech can just say you're done, and some sort of other diversity of income to say, you know what, that makes sense to me. Let me promote something I actually believe in, that I've been promoting and believing in for a long time. So, any other aspects of that you want to cover, or things that are unique about Impact that we didn't get to?
Look, I think to your point, we put on 4,000 members in the last 90 days, right? 4,000. And the math behind that was they saved $60 million.
Sheesh.
So those 4,000 people collectively saved annually over $60 million. And so that is a big number for a small group of people. And so, I feel a couple things. One is what you're doing is needed, right? People need to know about other options and, how to self-care and how to eat right and how to have the natural, let nature take care of you. And so I think there's a real synergistic opportunity for us to be able to let people know. Look, I tell people Impact is designed for smart people. And the reason it is because you'll do the research,
Yeah.
right? This is too good to be true, right? We've heard that a million times and a million, hey, Amazon's going to bring me a box to my house. That's too good to be true, right? Oh, I don't have to go to Blockbuster anymore. You're going to watch a movie online. That's too good to be true. We've all seen a lot of too good to be trues. Unfortunately, we didn't get compensated for spreading the word on a too good to be true.
Mm-hmm.
So, this is one of those that needs to be told. We've signed up chiropractic associations, the biggest association in the country. We signed them up to promote impact. So when we're able to get providers sharing with people they know because they're on the other side, right? Remember, we're still the patient side of things. We don't know what's going on behind the scenes, but when you have, complete associations promoting impact, saying, hey, this is good, like this is good for everyone. I think it speaks volumes about the product because again, we're only on the patient side, right? We saw the savings and pretty easy for us to do the math and hey, we've never really needed it and it's for the just in case. But when you go on the other side and have people on their side saying, this is better for the customer, we're not getting rich. The doctors are not, and newsflash, the doctors didn't get a 30% increase in pay, right? That's why they're going into the cash only practices and the direct primary care because they're not benefiting on these massive increases that are taking place around the country right now. That doctor is not making more money because you're paying more money.
Yeah. Well, one other thing I'll mention that for me, this has given me, as somebody as a health coach or somebody that runs programs, is it's given me creativity of how I can also help solve someone's financial problem. So free up the funds they need to be able to help where I can help. I can save, if I save you $2,000 a month on your insurance, it's pretty easy to find the funds to be able to afford other things to take care of your health. And that's been fun for me to be able to get creative and say, well, let me give people incentives within my own program to get into impact. And then everybody's winning.
It's interesting. Monty Phelps, big mortgage guy. So he's a customer, right? So did what we're all doing, right? Saved a bunch of money. And he was like, I'm looking at a loan application, right? Lady works for a major business. But remember, healthcare is not free for the W-2, right? They're taking money out of their check every week, right? So she's got $400 a week going out of her check for healthcare, right? So she's at $1,600 a month. He's looking at her loan application. He looked at what he paid for healthcare, to your point, $500, called her back up and said, hey, look, there might be another option. And we've got an extra $1,000 to put on your mortgage. And you can go get that house that you just said no to because you didn't have the extra $1,000 a month for a mortgage. And he was blown away. So I've had stories of people that have repurposed that savings into other offerings that the American public just said, hey, I would love to do that, but unfortunately I can't. And now they're saying, well, what do you pay for healthcare?
Yeah.
I think I found where all your money is, right? I found your retirement. The American public doesn't have a retirement. I found it. I found your retirement. It's been going off to a major healthcare provider that we can now repurpose back into your 401 or, another vehicle that can protect your family.
Yeah. So for any of you listening that are kind of somewhat business minded, or you're like Patrick and I, we like to say, how do we shift things on a much bigger scale? What would it look like? I mean, if you just imagine if millions of people started doing this, the amount of money that could go to other types of flourishing, that's part of the way that we vote with our dollars, and we don't have to shake our fist at the system. We just stop doing business with it. We just leave it. And the number of opportunities out there, if you have a creative thought of, well, how else could I help people switch to a better model, save money, and put it to use. So it's endless. Hopefully, we tickled your brain enough with different ways to imagine not just the patient side and the savings, but well, what could I do? Is this something I would want to be participating in to help people, perhaps both with their health, with their finances, and see where that goes. So if that's interesting, reach out and we can talk about that. But anything else we want to cover, Patrick? Anything I forgot to ask you that would make for a good footnote to this episode?
Yeah. So one thing we got to remember with impact, we don't have to be product experts. I know a lot of times people go, I don't want to learn a bunch of stuff. I don't want to have 27 questions. My neighbor's asking me colonoscopies and mammograms, and you know what I mean?
Right.
Like I don't even know what those are, right? So I think we would agree. What makes this relationship so good is we pass the interested person off to impact.
Right.
Let that sink in a second, right? My neighbor that owns an HVAC company said, hey, my wife's got a couple questions. I said, I will just send you in as a lead. Impact will reach out to you. They'll go through their entire program. If it makes sense, you can become a member. If it doesn't make sense, you don't have to become a member. It took me zero time
Yeah.
and zero education. The reason why I know everything about it, because I've been doing it for 4 years. But when I started just promoting it, I just let them talk to the experts. So I want to take that burden off of somebody here today that says, hey, look, I like it. I could see how this could be beneficial. I could see how people could benefit, but I don't want to go back to school. I don't want to spend any more time learning anything else. My brain's already overloaded, but I'm a great connector, right?
Mhm.
I go socialize. I belong to a church. I like to play cards on whatever that is for your audience member. Just remember, we are handing them off to a trained professional.
Yeah.
And the beautiful part of Impact is their nonprofit. So when people are done talking to them, it's not talking to a salesperson, it's talking to a teacher,
Yeah.
right? There's a different mindset there. It's let me educate you. This might not be a fit for you, but let me give you what we do. Let me tell you how we do it. And if you like it, welcome to the community. And if for some reason this isn't a fit, we're still friends and all the best. And there's no time out of my day.
Yeah. And you don't have to go through the automated labyrinth that people are used to with calling your insurance company. You just call and get your questions answered, and you talk to a real empathetic human who might actually pray with you. Like, what a different
What a
way to
novel
do.
idea.
Yeah.
They're real people in our country that you can talk to that will answer your questions. And we have lots of money. So we're not trying to go AI and a million other things to, put a million loops together. So we deny every claim or whatever else that looks like. Impact tries to find a way to pay the bill. That's the part that I think people are the most blown away. Is like they're trying to figure out how do we pay the bill instead of how do we
Ah,
not pay the bill.
right. Cool. Okay. Well, we'll kind of wrap up with that note. So, Patrick, for anybody that's listening that wants to find out more about you, Impact, what would be the way to follow you or
Yeah,
learn more?
so easy, just my name, Patrick Mazer, patrickmazer.com. All my links are on there. Welcome any questions. Just let me know how I met you, through the show so we can make sure that everything navigates back to you and your organization. And just look, I want to thank you because I've listened to your show and I know you're doing good work. And I just want to appreciate on behalf of people that can't tell you what you do is making a difference. I want to tell you that here today. So just keep doing what you're doing and thank you for making a difference.
Well, thank you for the kind words. I'll take that. And it's been great to having you. So thanks for joining me today.
Mhm.
Thanks for listening to Deconstructing Conventional. If this conversation sparked new questions or helped you see things in a new light, feel free to share it with a friend who is on a similar journey. Don't forget to subscribe so you never miss an episode and a perspective that challenges the norm. Check us out on our website at healingunited.today and find us on social media at Healing United, or you can check out the Healing United PMA app. It's a great way to stay connected. Remember, question everything and rebuild intentionally.